All right, today we're going to talk about something called cardiac ablation. It's a really common procedure for treating irregular heartbeats. So if you or maybe someone you know has ever dealt with a heart rhythm issue, this should clear up exactly what it is and how it all works.
So let's start with this idea. What if you could literally rewire a faulty heartbeat? I know, it sounds like something straight out of science fiction, right? But honestly, that's the core idea behind cardiac ablation. Let's dig into how it's done.
But first things first, before we can really get into the solution, we've got to understand the problem itself, and that is the heart's faulty rhythm.
Okay, so the official medical term for this is arrhythmia, and put simply, it just means you have an irregular heartbeat. It happens when the heart's own electrical signals, the ones that tell it when to beat, kind of go haywire. It can make the heart beat too fast, way too slow, or just erratically. You know, a really good way to think about this is to imagine your heart's electrical system has a short circuit. Some tiny little area of tissue just starts sending out these rogue signals, and it throws the whole rhythm off track. That's the exact problem that doctors are trying to solve.
So if the problem is basically a short circuit, how on earth do you fix it? Well, that brings us right to cardiac ablation, the procedure designed to fix that faulty wiring.
Cardiac ablation is a super targeted treatment that goes right in to fix that short circuit. Doctors use focused energy, either heat or extreme cold, to create these tiny, very precise scars inside the heart. Now, these scars aren't harmful at all. Think of them more like roadblocks that block those faulty electrical signals and let the heart get back to a normal rhythm.
So how do they actually do it? Well, doctors have two main tools in their toolbox. They can use heat, which is called radiofrequency energy, or they can use extreme cold in a process called cryoablation. But here's the thing. Both methods have the exact same goal, to create those tiny signal-blocking scars. So, you might be wondering, who is this procedure for? Well, cardiac ablation is often the next step when medications for arrhythmia just aren't cutting it, or maybe if they're causing some pretty rough side effects. It's a really powerful option when other treatments have fallen short.
All right, so let's talk about the big day. What actually happens when you go in for the procedure? Let's walk through the whole journey, step by step, to kind of demystify the experience.
First thing to know is the time commitment. A typical cardiac ablation procedure takes somewhere between 3 and 6 hours from start to finish, and that gives the medical team plenty of time to be really careful and precise. So, the day itself has a few key steps. First, they get you prepped and comfortable with an IV and some medicine to help you relax. Then comes the really amazing part. The mapping. They create this detailed electrical map of your heart to find the exact source of the problem. Once they've got it pinpointed, that's when they apply the ablation energy. And after that, you'll just rest for a few hours so they can monitor you. And believe it or not, a lot of people go home the very same day.
Now, of course, with any medical procedure, it's really important to have a balanced perspective. So let's dive into our next section, weighing the risks and the results.
Let's just take a clear side-by-side look. Like any procedure, there are some potential risks, things like bleeding or infection, and your doctor will talk you through all of those in detail. But then you look at the potential results, and they can be absolutely life-changing. We're talking about restoring a normal heartbeat, blocking those faulty signals, and seeing a huge improvement in your quality of life. That might mean being able to walk up a flight of stairs again without getting winded, or just getting back to the activities you love.
And honestly, this quote from the Mayo Clinic's research really sums it up perfectly. It's so reassuring. For the vast majority of people who have this done, the benefits are just profound.
And what about after you get home? Well, the good news keeps coming. The recovery is usually really quick. You might feel a little sore for a few days, maybe up to a week, but most people are back to their normal routines within just a few days. The only real restriction is to avoid any heavy lifting for about a week.
So we've covered the problem, the solution, and what the journey looks like. Let's wrap it all up with what this actually means for you.
After all this information, what's the one thing you should really hang on to? Let's distill it all down to the most important points. So here's what you remember. Cardiac ablation is a very precise procedure that goes in and directly fixes the heart's faulty electrical signals. The whole journey is well managed, usually lasts just a few hours, and has a quick recovery. And, maybe most importantly, it has a really high success rate for improving people's lives. Just knowing this stuff is a powerful tool you can use to have better, more informed conversations with your doctor. So, we'll end right where we started, with a question. Now that you're armed with this knowledge, you can really think about it. Could this procedure be the reset button your heart needs? It's a great question to bring up with your doctor. Thanks so much for tuning in.